sure, policy and you with Aldel disease, and
Yep.
I will be there too. We will do once a month. So we build this group forward together fantastically.
Excellent.
That's great.
Yeah.
And I'll keep my son's gaming headset because it's got now a presence.
Very good. Very good.
It's your
Very good.
character.
Kind of crushes my hair, but other than that, it's okay. So numbers continue to grow. We've got almost 30 people on the line right now, so that's super. Another minute or two and we'll get started.
And we were noticing, Doris, that we have some new members this evening that haven't joined us before. So just for those of you who are new, we do these webinars from 5:30 to 6:30 twice a week, Mondays and Thursdays. And Doris always joins us, and they're a real great opportunity to share what is happening in the field in your situations. Largely it's NPs in long-term care, but we are certainly welcoming NPs who join us from whatever the setting. And we've been able to share issues and concerns and some nice cross-sharing, which we certainly encourage, and then provide ways to share evidence resources and the latest directives with you, and always are looking for emerging issues that certainly Doris takes forward, gives them voice, and generally they end up in a new directive or policy or some type of action. So that's been how we've been working here as a group in this forum.
Excellent. So I see we have a large number of people today, so that's beautiful, 33 of you. So glad to hear. We have a nice agenda that the team put together. Let me start by saying that as I sat yesterday to write the report, which I would like to hear if people receive the report. If you can write in your chat, yes, yes, yes. And if it's a no, also write no, so that we put you on the list. If you take a minute about the daily reports that I write.
Yeah, just a yes if you're receiving it, or no if not. Oh, lots of yeses, Doris.
Okay,
lots,
if any
yeah.
of you is a no, write the name and we will make sure we put you on the list. So the reason I was starting with that is because yesterday, as I was thinking that I'm advancing nicely on the report and I was going to be able to sleep at a perhaps decent time, I got the email at about 1 a.m. with 12 directives, 12.
Mm-hmm.
And I know, and that ended up the sleeping at a decent time because I started to read all of them to see really what they did. And yes, many of them are directives of issues that we have requested before. So as I say, often we cannot buy back time, but we can make it the best that it can be for the remaining of this first round of COVID-19. In my view, and in the view of most, will not be the only one. There will be clusters after, so any directives that we get are welcome because we will take them forward. And also they reinforce that, that what we were asking was the right thing to ask. There is one issue that has not been addressed, and I will continue to push it. In fact, I wrote about that in the report today, which just went out now. And it's the issue of contact and case tracing. There is very inconsistent deliverables on case and contact tracing, both across the country and in particular also in Ontario. Some of my colleagues, especially Heather, will not be surprised to hear that Ottawa is doing fantastic with that. I commented when I don't know if any of the colleagues are from Ottawa. Are any of you from Ottawa, so you can take pride on what I'm going to say?
Just our note in your chat box.
Any from Ottawa?
Yes, well, Jean
so,
Benton.
Okay, so you need to know that, and you You will see it in a tweet that the office just sent, Madison just sent on behalf of RNO. I spoke on the radio, and just before I came into the radio and was the outfit in Ottawa, the previous person was the Chief Medical Officer of Health of Ottawa, and the Leslie, the reporter, was thanking her because of the tremendous work she was doing, and that she really was was becoming, like Dr. Henry for Canada kind of thing, and for BC, she was becoming a very sound, calming, and also solid voice in Ontario. And that was very nice, and that was the preamble to the interview with me, where I said that you're totally right, Ottawa is doing fantastic, and he said, I mentioned the physician, and then I said, and Esther Mogahan, who in fact has played a leadership role because she was the first to bring 50 nurses from Via Nurse to the Ottawa Health Unit to actually do case and contact tracing, and that's why they are doing so good. And so kudos to the team, et cetera, et cetera, et cetera. And then I get a message from Esther that someone told her that I had mentioned, and she's thanking me for that. And she's saying, by the way, we didn't bring 50, we brought 100. So here you go. I was not even aware that they have increased the uptake from Via Nurse, 100 nurses working on case and contact traces. Meanwhile, that we have our Ontario Medical Officer of Health, unfortunately, saying that they cannot do enough contact tracing because they don't have resources. Well, the docs on Twitter, and myself, of course, and others now, Lamo and others, are saying, where have you been? We have thousands of people for you, just use them.
Ask and
So
you
this
shall
is
receive.
critical for any of you that hear, anywhere that you are, you have a key role as a leader, any of you that you hear anywhere, we cannot do A, B, C, D, E, F, G because we don't have resources. Say, absolutely, you may not be aware, start with the nice, you may not be aware. There is Via Nurse with RNs, with NPs, with PSWs in the form of nursing students. And if they are aware and you can notice they are aware that just using that as an excuse, it's time to call it what it is, no more excuses. Because we cannot continue to lose people, both in nursing homes and also in other sectors that we are losing people because we are not doing sufficient and consistent, robust contact and case tracing. So that's the only gap that we still need to push forward, and we will, and we are going to get it, hopefully sooner rather than later. Some say the premier, before he speaks, he has read my reports. I hope so, because I think he's doing a tremendous job in pushing the agendas and in saying, no, we are not reopening for business, as is the Prime Minister, because quite frankly, guys, we are not even close to being ready. So, I also itch to get out, and I also itch to be with my grandkids and kids, but, being at home is not being stuck, is being safe. So with that preamble, maybe Heather, you can give us an update on all of our fantastic initiatives that you are leading, and that soon we will have the website revamped again into a fantastic portal that will really feature those pieces even more front and center, because people are asking for some of those supports and they are not fully aware.
Sure, absolutely, Doris. So just as a recall, we've been meeting, this is our second week, end of our second week of meeting with this group, I believe. It
feels to me like 2 months.
But we've been able to accomplish a lot together. So in terms of responses or resources in response to COVID-19 emerging issues, we've been able to leverage the expertise of our long-term care best practices team to help respond to some of the areas that you had identified as needs in terms of resources and tools for the work that you do. So we have on our website resources focusing on suggestions and strategies for isolating residents in long-term care. So that's been up for a couple of weeks now. And I do hope that you're utilizing that. For those of you that aren't in a COVID situation right now, obviously, this is the time to plan and prepare. And for those that are, there's some good suggestions and strategies that we've gathered from long-term care homes to help provide you with some suggestions. So please do have a look at that. We've been regularly updating the palliative care delivery and long-term care during the COVID-19 pandemic, and actually have just revised that today. So that'll be going updated on the website, if not tonight, first thing tomorrow morning. And again, we're just trying to keep up with, there's a lot of new resources happening, and our team has been trying to respond in a way that's going to be meaningful to you. A number of resources that we've gathered together on mental health, resources for psychosocial support during the COVID-19 pandemic. And again, these are resources that you can use in your own practice, supporting your colleagues, and then maybe recommending to your colleagues for their children and other family members. So again, just in your leadership role as an NP in long-term care, and quite frankly, they're probably applicable to many sectors, but we were kind of, as we were developing them, really thinking about long-term care. And then earlier this week, we posted a poster, that you can use in your practice, about possible COVID-19 symptoms to report. And this came forward actually from Jean Benton earlier this week, or maybe late last week, probably a week ago at this meeting, who said that she really needed some resources to help support PSWs to bring forward critical symptoms that were evolving that she needed to know about sooner rather than later. So that resource was released early, Friday of the holiday weekend, and we revised it, updated it, and made it look a little bit prettier so that you can post it in your workplaces and use it for that purpose. We're also in the process of working right now with our communications team on further resources to help support the care of individuals with COVID who are not at end of life, but that need support. So those are some of the emerging issue documents that we've released based on your needs. And then of course, we've got our Facebook groups that we have developed as well, some that came from this forum and some that have come from others, but one focusing on connecting families in long-term care. We have well over 150 families participating in that now.
Are they active, Heather?
They are very active, and it's been really quite delightful to see them sharing their ideas, their comments, etc. So that's been fabulous. We released two.
Could NPs, but only the NPs that work in nursing homes, really.
Well,
be part of it too.
Well, I think that they could, but the purpose of it is really for families. So
yeah, it's true.
Yeah, so we've been
Actually,
we've been kind of encouraging. I won't say we're not letting other people join, but we're kind of redirecting them to other sources. Yeah.
But maybe, Heather, what you can do with the team is kind of pulling out key questions with key answers, if there are, both to post there, and that you can share them with NPs, so they.
Sure, we can do that. Yep. So we're doing a weekly summary of the themes on every Monday, so we can absolutely pull that forward for you, and for this group, because it's important that you know what's happening with your families as well. Right now we've got over 157 members in the Connecting Families group, and our two other groups that we launched, really, Doris, actually, I guess they launched with your Good Friday report last week, was the peer-to-peer support group during COVID. So again, this is very much for yourselves and your colleagues to connect together, and the sharing and tackling emerging issues together. So that's more about reflecting on the emerging issues that are coming forward and how to kind of strategize and problem solve. So we have policy members that are helping to support the sharing and tackling emerging care issues. Irma Jean's part of that group moderating, as well as colleagues in our IABPG team. And then we have members of our RNO TAP that are also supporting the peer-to-peer group. And then the Connecting Families obviously is a long-term care team member. So those are continuing to grow and be hopefully a good support to you and to your colleagues as we move ahead.
You know, Heather, it just occurred to me on the peer-to-peer, ask Madison to tweet about that.
Okay.
Because I keep hearing from the media of people that want support, and I mentioned it, but it didn't occur to me that to tweet. Just make sure that, and also the other two, just make sure they know that this is only for families, only for healthcare providers, and
And
we
they're
made
considered private groups.
Yeah, they're private groups, so it's not open to the.
So, but still, let's tweet because that would be fantastic. Yeah.
Sure. Okay. No, I've made a note of that. So lots going on. Obviously, there's been lots happening in the last couple of days in terms of changes to directive, well, not even a couple of days, the last couple of hours to the changes in directives. But those are some of the things just in terms of work that we've done over the last week or so that we hope will help provide supports to you in your communities.
Very good, very good. It will be interesting to see, I mean, MPs work full time for the most. One of you, Mike, I don't know if Mike is there today, but Mike is the one that last time he said, what happens, remember that, I don't know if Mike is, but on the issue of virtual versus in person. So actually what he spoke with us helped me when 2 days ago, the government called me to give feedback on the proposed directive of working in only one place. And I said, yes, but let's not forget that that's physical work. That if they're doing virtual work, they could work one place physical and the other virtual. And they really thanked me for that because they had not thought. Well, I only thought about that because Mike, one of them, raised that. So here you go, guys. The feedback you give us really makes a difference to produce impact on policy. So let's start actually with that, a question about, any questions about the directives first, if people have. Before we even do a round table, because there were lots of directives, one on working in one employer only, and that for NPs is, well, for anybody is physically, right? Virtually they can work with more. The other is the directive on universal masking, that is very important. I hear from Heather and the team that we are better with supplies, that we are not crying on the same day at least for supplies. So I want to hear also from the MPs, their perspective, how is surgical mask, because right now everybody will need to use one. So that throughout the entire shift, doesn't matter with which client, so that which resident, so that's important. The issue of isolation, that continues. The issue of they are increasing testing, so they say, so I want to make sure it's the case. I have no reason not to believe, I just need the pulse on the hand to know that it's not only after an outbreak, and if it is after an outbreak, is to all the client, to all the residents and all the staff, not just to some. And hopefully we start to see some surveillance, which will be random checking of residents before, for the 150 or more homes that don't have an outbreak. Well, 500. I think there is like 540 that do not have an outbreak. That's important to remember. So we want to do surveillance on on those homes just to make sure that things are okay randomly. So let's hear what are the questions. I will stop there.
Yep, so let's see, you're welcome to either take yourself off mute or put your questions in the chat box. We just had one call.
Yeah, I think we have Deirdre, right? A few issues with homes and RSV outbreak and other non-COVID outbreaks not being given priority for PPE, even though it is crucial for staff and residents.
Well, right now, everybody needs to go with PPE, so that question now, it's over, right? Everybody needs to use PPE universally.
Doris, I was just speaking to the fact that the PPE requirements of homes that are in respiratory outbreaks that are non-COVID-19 outbreaks are not given priority by the ministry to receive PPE.
So I'm going to say the same again. Everybody, outbreak or not, needs to use universal masking now. So as for masking, everybody needs to use, that's the directive, not just people on an outbreak. Okay, and then of course for other type of outbreaks, if they are GI outbreaks, you need the gowning, you need a much more than just the surgical mask, right?
So I'm just looking to see if there's any comments in the chat box, and I don't see anything else coming in. So we could do a round table just to check and see what people's comments are, Doris.
Fantastic.
Yep, okay. So I'm going to call on people, and some of them don't have names here, so I'll just do the best I can. So Sarah, maybe you could go first. Sarah Bedley?
Yes.
Yeah, would you like to go ahead? Have you got any comments to make, any questions that you might have?
I don't have any questions right now. I was just listening to other people.
Okay, that's just fine.
Is
Cressida.
Claudia there? Claudia?
I haven't seen Claudia yet, but I haven't gone through.
So send her a note. Send her a note one of these days. Tell her that I was being interviewed in a radio yesterday that had callers calling for questions. And a gentleman came on to talk about the good care that his wife was getting on, she's a Silverthorne home, and that it was so good, and etc., etc. And then when I needed to answer, I said, I'm so glad the care is good, and please know they have a nurse practitioner. Her name is Claudia. And I gave her name. And I said that it makes a difference to have nurse practitioners in the home.
Fabulous. And I've just been reminded here, because I was supposed to start with a question that Jean had actually asked that we pose to everybody ahead of time. So we did send out this question to those on the call. And Jean is interested to hear from NPs who've had experience with COVID-19, sort of strategies and tips. So I think that was the question we sent. And she's looking for those of you that have had situations where you've needed to care for individuals or support the care of individuals with COVID-19 in your homes. What strategies, tips can you share with the rest of us in terms of the approaches you've taken? And Sarah, I think you wanted to make a comment. Oh, at least your name came up on the list here, so I'll just see.
Do any of the colleagues in the call, 35 of you, do any of the colleagues is in a home that there is an outbreak? I would be interested to hear that too.
It's Wendy again.
Yeah, go ahead, Wendy. Yeah, thanks, Wendy.
So we are still in outbreak. We could be close, knock on wood, April 20th. We might be allowed to come out if we have no new cases of either staff or residents. So we had a total of 6 in our facility, 6 residents. 2 of those 6 have passed away. 1 is very close to dying. Another one I thought I was going to lose, although she turned the corner yesterday. It was beautiful. So I think we might be okay. And then we've had 5 staff test positive as well.
And they're at home, Wendy?
They are at home, yeah, and infecting their homes as well. So a lot of their families are getting sick now as well.
Really, huh?
Yeah, which is too bad. But yeah, so the staff are getting better too. So what we've seen is if they're going to get sick, they get sick around day 5, 6. Between days, I would say between days 5 and 8, you will know whether they're gonna kind of make it through or they're gonna get worse with it. I found at the beginning, they did not look sick at all. Like we caught most of them with temps, not with a lot of respiratory symptoms at all. So I guess that's where the temps are really important to get on top of. When we found that we had 2 in our 15-bed unit, thankfully it was only a 15-bed unit, we shut the whole unit down. We treated everybody like they were sick. So
That's
put
good.
all the residents like they were ill. And then I think that has really made the difference in terms of our spread numbers.
But Wendy, so you didn't separate the 6 with symptoms from the other, huh?
We moved nobody. I don't know how you move people in long-term care when they talk about shuffling that, because they've got all their stuff in their rooms. That's the only thing they know. Like, I think it would just create chaos. So we left them exactly where they were. We didn't move anybody and we just worked around them. We kept 1 unit clean, a 30-bed unit clean, and we had 2 units, one 17-bed unit and one 15-bed unit. We were very fortunate because we have a beautiful facility with all private rooms. I don't know
Where do you work, Wendy?
I'm at Greenwood Court in Stratford.
Greenwood?
Yeah, Greenwood Court. Yeah, so I don't know how you facilities that have ward rooms still with just curtains and all share bathrooms managed like that would just, I just commend you even more. I think that's one of the reasons. The other thing that we did, because you're going to get overwhelming calls from families as soon as there's one positive, I have been doing a daily update for families.
Wow.
So we have a one call list. We've got everybody's email, and we did contact families to make sure we had emails for them. And I send out a note every day with what's going on, positives and negatives, how many are, how many swabs are pending, what's happening with staff, what's happening
So
with
you do with all of them together or with each one?
I do one note that the ED then sends out just one mass email to this whole list of people. I think it's called One Call, I think is the I don't know, the IT platform she uses to make that happen. And that has saved us a load of grief. And I just keep reiterating, if you haven't heard from us, it is good news. Your loved one is functioning as they do on a regular basis. Connect with our rec staff so that you can virtually visit with them through this time and just assume all is well. And please respect us because we are like overwhelmingly busy. And we went from having, that first day, I don't even want to know how many, I was also the communication person. I think that was helpful. You make one person your communication person with families, so that they're all hearing the same thing. So that's all I did. I've been reporting all the swab results. I've been communicating. And then what I did was ask them, if you have questions, I will reply to these kind of general questions in my daily updates. So today I even, you get questions building up. A lot of people wonder how the residents and staff are. So I sent a really general kind of reply out. Again, they wondered when the outbreak would be over, what the new normal is going to look like. So I try to do like a Q&A and answer them for everybody. So that has been very valuable. And then we send that to staff if we think there's important things in it as well, so that the staff are all up to date on what's going on. The biggest overwhelming issue, I'm like a broken record, is the staffing. There are so many, especially the PSWs, who just cannot, for either childcare reasons, their spouse can't work if they don't come to work, just in like any reason, they don't show up. So you can never have too many staff through this. And then you think you're finally well and somebody's sick, right? So got a call from an RPN yesterday who's got a stuffy nose. It's just nasal congestion, no fever, but you're like, oh, we're doing so well, we're so close. So no, you can't come into work, right? Call the health line, get swabbed. Because we're 5 days away from maybe being out of this. But then there's a big hole. She works full time. So who picks up those shifts? I don't know. But we'll figure it out.
Wendy, a couple of things. Is it possible, just out of, the Q&As don't have names of patients. Could you send us a couple of Q&As to see them?
Oh, you want to see what I've sent out? Like
I would love to, and I want more than that. Can you write a 300 to 500 word submission for my report?
What? You want me writing something, Doris?
Yes.
Yeah.
I will fix the writing.
Wendy, it's just exact.
I will fix the writing. Don't worry. Just write the story of exactly what you spoke and what you're
Just
doing.
what you said, Wendy, is perfect.
It will be amazing. That's number one, please.
Okay. Yep, I will do that.
Yeah.
The other thing that I think
But I didn't finish the asks.
Oh, okay.
So if
That's
you
why
can do
she's
that,
carrying on.
if you can take a little bit of time whenever, but no later than the weekend. So because after that it will not be useful. Now it will be very useful.
Okay.
Right? Even if it's 300 words with the key things that you do. And the other thing, would your ED, and you can ask her, allow you to speak with the media?
I don't, I guess we have a media spokesperson that we've got.
No, I don't know.
You don't want that? Okay.
I tell her that I need good clinicians to speak with the media. Tell her desperately I need. And this is a good story. It's not a bad story. And maybe you can speak the day in 6 days when you are getting out of it. So there is a good story, but I need to know like within 3-4 days if she will allow you, and then you tell me green button because it's clean. And then absolutely, it would big news because people need to hear that we get out of it.
Yeah,
And that
yeah.
when we have good clinicians, not only doctors that are clinicians, but NPs and
Right.
nurses,
And
that
I
we
can
get
tell
out
you,
of it.
the physicians have been absent. I've been very,
I know that.
we feel abandoned. Yeah.
I know that.
And
You
these
wouldn't say
homes
that
are,
in the media, but what you would say in
No.
the media is what your role has been.
Yeah,
And
yeah.
all these pieces that you have been doing that brought you from an outbreak of 6 people and 5 staff to now out of the outbreak. Like that is fantastic.
It is amazing,
Can you
actually.
ask her please
Yeah,
sooner
I
rather
will.
than later?
I will, yeah.
Yeah,
Fantastic.
and Doris,
One
our
thing-
long-term care coordinators are just offering to help Wendy if she needs some assistance with writing hers.
Oh, the letter write and send to me. I can help with the writing.
That's
What
the
I
thing.
need is her thoughts on what she's doing from the heart and from the brain.
Yeah, and then the other thing that
But thank
I
you.
just
Thank you
want
for
people
the,
to relax with is palliative care through this. It's no different than how we provide palliative care through an influenza outbreak. So my residents, the ones that are dying, die the same way people with dementia die. They stop eating, they stop drinking. They haven't had huge respiratory symptoms. We're not using nebulizers, obviously, so we manage it just the same way you manage end-of-life care with anybody else. So
they're not in big distress.
no, they haven't been. The one really
Well, you're
struggled with
lucky
his
because that's
breathing.
not always the case.
Yeah, so we've been okay. Our dementia patients have just stopped eating and drinking and more or less die from dehydration as opposed to,
Respiratory.
yeah. So we've been fortunate that way.
Great job. Great job.
Mhm.
Yeah.
Great
Oh,
job.
yeah,
Well,
that's
I don't think
terrific.
you have just been fortunate, sorry to say.
Well,
That's
we've
the
got
piece
a-
that's the piece I will change in your writing.
Yeah, we've had
You
a
have been a
fantastic,
fantastic clinician. That's what you have been. You're
yeah,
qualified.
and fantastic management team. Like they really,
Beautiful.
Yeah, yeah.
Beautiful. You can submit it together, you and your
yeah.
team
Okay.
there.
So I will
Mhm.
send you a few of my updates that have the Q&A stuff in and a 300, just a point form.
Yes,
And
yes,
you make
with
it
all
sound-
the initiatives, like when Heather reported all our initiatives, all of yours, the daily call, the daily this, the daily that, you know, if they want to know more, we can put, if they allow, if you allow, they can connect with you.
Mhm. And I think also, Wendy, it's really important to indicate how careful you are with staff. You know, that if they have respiratory symptoms,
They stay
don't
home,
come
yes.
in.
Yes,
That
Imagine
just
is
so
right because we
critical.
hear over and over about the famous working quarantine.
Oh,
I know, and we almost did it yesterday. This RPN called and we're like, oh my God, we can't lose her, right? You just get this sick feeling. And then on the way home, I texted back, I said, we can't do this. She needs to stay
Good for
away. She needs
you.
to call the health line.
You
We
see
got
that
it.
you're not lucky?
Oh,
You see
yeah.
that
Yeah.
it's not you're lucky, you're smart.
It's
Well,
good clinical
oh,
judgment.
That's why you
Wendy.
drive 20 minutes from work, isn't it? So that you think, but
That's
anyhow.
good. That's
Yeah.
good.
Doris, we've got tons of questions in the
Yes, we
chat line.
do.
Do you want us to bring some of those
Please,
forward? Yeah.
Please.
So, Imogene, have you been keeping an eye? I have too, but
Yes, I have. The first question actually, and I'm wondering if this is directed a little bit more to Wendy, but she's in, there was a question of, did any of your residents get transferred to hospital? I don't know, Wendy, if that is anything
No.
that applied to you. No, okay.
No, we had very clear directive from our emerge that we were not to be transferring anyone. Now, fortunately, I've got a good relationship, and this is where it's all about relationship with families. And we had previous conversations with most of them that this wasn't in their plan, their goals of care, more or less. So fortunately, we didn't get into that position. I guess our emerge has it set now that we can transfer people, but we have to do a physician-to-physician conversation with the emerge doc before we do it. I'm assuming they'll talk to an NP, although I've had them not talk to me before, but I would push that. So I don't think they would say no. Our hospital actually has nobody. There's nobody in our local hospital, Stratford, with COVID. So I actually think they would welcome somebody at this point, which is because they're ready to go, but they have no patients. So we get a call from the hospital, which has been really nice to say, how can we help you?
Which brings me to the other issue that I forgot to mention at the beginning. One of the other directives is no more transferring of people from hospital back to nursing homes.
Mm-hmm.
Yeah,
so that's a directive.
Yeah, that's
it's
good.
Very important one.
Yeah.
Yeah. Okay, so I'll move on. There's a question here about, can an MP sign a level of intervention after discussion with POA? That's from Q Ho. Are you on the line that you might want to explain that anymore?
So I would answer definitely to that. We can.
Okay.
That's how I would answer that question, but as an NP.
Good.
Okay. And then does anybody have a script for registered staff to use when calling families to say that med passes are being changed from TID to OD?
We did not let people know all those little details.
Mm-hmm.
I agree.
What I tried to do was do one med pass on days, one med pass on evenings without impacting care. I did not change anybody who has Parkinson's disease or who has pain such that we need to medicate on a more frequent basis, but anybody else I just moved to twice a day med passes. So we did not, I only let families know if I'm changing, like changing something where I don't think the little changes I made warranted a phone call.
Yeah, yeah.
But
Okay.
that's my perspective only.
Yeah, okay. I have a question from Cindy. And it's, I'm being asked by my manager to provide my billing code to order COVID-19 tests for all residents and staff at one of the supportive housing. I'm not employed by the supportive housing. I work for the geriatric program for the same organization. My concern is I do not know residents or staff. I'm not their primary care provider either. I do not feel comfortable just to give them my billing code. I don't know if anybody can help out there, or if that's an online discussion with anyone.
Looks like we've had a few responses in the chat. Cheryl's saying the homes keep a list of MD's billing codes. I'm not sure I would have a problem having tests ordered if I was covering the area. And then I think I saw some other comment about that they were feeling
Michael.
that would be, yeah, Michael, yeah, I would be okay. Yeah.
Yeah. Okay, well, maybe we'll leave it at that. And then I really like the idea of daily emails sent to families. What a great way to keep them connected and keep them informed. So kudos to you again, Wendy. And then Sally is saying, yes, this is great in terms of the billing codes. And then since there are less staffing, is there any way newly graduated NPs with no prior experience can contribute in this situation? So you mean contribute?
I think absolutely yes.
Yeah.
A graduate NP has been an RN before, and while you may not practice at the level of a seasoned NP, if the house needs, someone with knowledge, you are fantastic. And our colleagues, those online here, plus us, we can all pitch in to help. So the answer is yes.
This is great. And Wendy, you're getting lots of kudos. And the email.
You will get even more kudos when her piece goes to 250,000.
Yeah.
And then when we get it in the national television with millions.
And Wendy, you're getting, you're influencing action. Others are going to take your example to their home. Now, here's Corsita asking about accessing results from COVID-19 website. It says that the ordering MD needs to access. Ordering MD unable to access or receive notification about testing. Any experiences with this or helpful suggestions? Anybody have a similar?
Go again, Irma Jean.
Oh, with the question?
Yes, please,
Yeah.
sorry.
So this question is about accessing results from the COVID-19 website. And I don't know if you're saying this, Corsita, that the ordering MD needs to access these results. And
you cannot access? I thought you guys could.
Yeah, I'm surprised at that.
Corsita, can you comment on that at all? And take yourself off mute. We heard
Hi.
from you. Yeah, go
Hi.
ahead.
Yes.
Hi.
Hi, everybody. It's Corsita. Thank you. So the situation is that I've gone onto the COVID-19 website to access the test results. It's saying that only the MD who ordered the test is able to access it. So there's
because for privacy, probably.
Mm-hmm.
Yeah,
and
that
so
makes
the
sense.
issue, okay, so the
Sorry.
MD, so when I contacted the MD who ordered the test, the MD says they were not notified that the test was even completed. They're not able to access it either, even though they've gone through whatever their system is. So this test remains unreported, and public health has not notified the patient either, because they said that public health should call. I spent an inordinate amount of time up to today trying to get some help in this situation. So called public health, the number that I was told to call, the central number. I called the 211 number. I called the 311 number, and the 7600 number.
Corsita, is this, let me ask this from colleagues and from you. Is this the only situation you have had like this, or there are many like this that everybody's aware, where you cannot get the test results and nor can the ordering person?
Yeah, so this is my personal first experience with it, so I don't know. That's why I've put it out there. I don't know.
No,
if
I
this
am
is
glad you did, Corsita, but I want to hear if others have. Because if it's only one, it's a mistake. If it's many, it's an underreporting of cases, which will concern me greatly.
Mm-hmm.
Have others experienced the same?
Can we hear?
Can all of you that have done tests, just 1 second, imagine, can all of you that have done tests to residents receive the results, yes or no?
Doris, we've got Wendy saying we get our test results back through the health unit only. Others are saying yes, yes.
Yeah, so everybody is. So Corsita, maybe the test was never actually finalized here.
Well, it said, so initially there was not any date, and then when a few days ago, I think 2 days ago now, they said that it actually showed that the test was done on the 3rd, that it was reported on the 5th, but there's no callback. So but the physician, initially when I was speaking with the physician, that information was not available at that time, but that was the update as of yesterday when I checked back. So, but still I can't.
Order through the physician versus you doing it?
Yeah, I'm not sure. I don't really know.
No. I'm saying to start with, why did the physician order the test versus you, that you are working there full time?
Versus you.
It was the situation that day. I wasn't on.
Okay, I get it. I get it.
Okay.
I get it. So that physician will need to get on until gets the results. Otherwise, my suggestion is repeat the test and you do it.
Okay.
Don't wait.
Yeah, and I think that's very consistent with what's coming through on the chat is that
Yeah.
get the NPs to do it. You're responsible for your billing number and you can order a test. Yeah.
And
Yeah, but understood
I
that you
would just go ahead and do it.
Yeah, but so here's the problem now with resources, right? You're gonna pay now again for someone
Well,
to,
you know, it's a one-case
Oh.
scenario. Obviously, it's not
Yeah.
every day, and you're spending a lot of time trying to get the
Yeah.
test
It's
versus
true.
doing other things.
Yeah, it's absolutely true. That's true.
Yeah,
That's what I've,
yeah.
yeah, it's been a
Yeah.
lot. Yeah. All right. Thanks, guys.
Oh,
okay, yeah,
thanks for
lots of
clarifying.
Chrisita,
Yeah.
look in the chat, Chrisita. There's a lot of suggestions there too, and reinforcement
Okay.
of what you've been doing. Yep.
Perfect. Okay.
Okay.
Okay,
Thanks
should
a
we
lot.
go on to Siobhan's question?
Yeah.
Your community palliative care NP, a lot of patients are elderly, multiple comorbidities, similar to LTC, and looking for what does the COVID trajectory look like? And I don't know, Wendy, you've talked a little bit. Anyone else want to share, Wendy or others?
Oh, it looks different. What I've seen it looks different for different residents. I've had one that sailed through it. She's had temps, but it doesn't seem to affect her at all. And she goes about her day like we're the ones, and I say that, you know, with a good heart. Then I have others, like I have seen fevers for up to 10 days and high fevers, like 38.8s. 38.5s, what I call fairly high, not just low grade fevers. We have not seen a lot of cough at all. Maybe a little cough, but not much cough. I've really seen, and then fatigue and just not eating and drinking well. So I guess that's the trajectory I've seen. And like I said, if they're going to get worse, it tends to be around day 5, between day 5 to 8, is what I've seen. And they are kind of unwell for quite a while. Like we're re-swabbing now. We decided we were going to re-swab them all before they come out, and we're on 14 days, and we can finally say they're probably symptom free at 14 days, the ones that have made it through.
That's Wendy again, huh?
Wendy,
Yeah.
Yeah. Does that
Send
help?
me her contact, please.
Does that
Wendy,
help?
Wendy, Wendy or Siobhan, does that help? Siobhan, are you on? Okay, maybe while she's turning her mic, I wanted to ask Wendy, when you say the symptoms get worse, are you finding that breathing becomes a difficulty?
We have only had one who has chronic lung disease. So his breathing was lousy before he had it. So his breathing got worse. Others will they can't tell you what they're feeling, which is the hardest part. So one gentleman will say it hurts to breathe. I can get that much out of him, but I don't able to give me what they're feeling. I've had staff complain about that loss of taste and smell. None of those staff have been swabbed positive at this point that I've had complained
So
of
they
that.
have been swabbed and negative?
Yes, those ones, but they didn't have a temperature or any other symptoms. They just say, I lost my taste and smell. The one I think had some sinus issues, right?
But you told me they have been tested negative.
Yeah, they were negative, so they did not have a positive COVID. So how about loss of taste and smell? I did not get that complaint from residents. I had that complaint from staff, but those staff were tested negative, not positive.
Okay, I'll move on then. Someone wants clarification.
Oh, just to comment for a second. Wendy, you are aware that 25 to 30% of the tests are false negative.
Oh, Jesus.
Okay, just to make sure that you know.
Now there's different testing. This is where I'm confused, right?
Yeah.
Is it this?
But I would suggest on those staff that tested, that had sense of smell and taste loss, that be tested again. That's what I would suggest.
Okay, is that?
Is emerging as one of the indicators. And
Okay.
in fact, I shared with my colleagues previously, I think, that there is a team from Columbia University and U of T doing a major research on that.
Okay.
And yeah, and they're doing not comparing, side by side the regular test with a test on smell and all of that stuff, which if then it can be parallel. Just picture how easy it will be for people at home. Anytime they cannot smell the lemon, to be aware of maybe something else, even if they're young.
And that's where it's hard to know how much is that people are reading this stuff and then think, oh, maybe I don't taste and smell. I don't know.
Well, I can tell you one thing. You put a lemon or onion in close to me and I smell it, regardless. You know what I mean? And I can tell you that our friend of Ricardo and I in Spain, who is a researcher himself, not on healthcare, but on other things, without knowing any of this story, because it's when I was telling him about the research, he said he completely lost the sense of smell and taste. And he was really, really doing badly. So who knows, right?
Yeah. It's so, but unfortunately the residents can't tell us. That's I just see what I see. Yeah.
Yeah.
Oh, I do appreciate Siobhan here. Sorry, I finally got my mic working.
Okay.
But
I'm saying about the stuff that you said that lost sense of smell and taste, just because of the issue of the 25 to 30% and false negatives, that perhaps it's worth it if they have other symptoms also, that they be tested again, or at least leave them in quarantine anyways for the 14 days.
Yeah. Siobhan, you wanted to ask a question?
No, I really appreciate that trajectory information. It sounds, I was wondering if it would look more like a failure to thrive kind of situation. And it sounds like that's kind of what you're seeing, and at least at your home. So it's kind of helpful to know that. I really appreciate it.
Good, thanks, Siobhan.
Okay, so I'll move on then. One of our members has said, today our CEO informed us all of our residents who are COVID positive are to be transferred to hospital. The residents, the physician and I have conversations with do not want their loved ones transferred. Of any experience with this? Wendy, you said none of yours were transferred. I don't know if anyone else had any experience with transferring any of their COVID positive residents.
That's interesting. Is that from a long-term care home or a different kind of home?
This was Jean. Yeah, Jean, can you comment? You're in a long-term care home.
Is she?
Right?
Okay.
It's a long-term care facility. And our CEO called us all in for a meeting today and informed us that all our residents are to be transferred to the hospital. So the rationale she gave is that this is to help stem the tide within long-term care. But the physicians and I have been holding our conversations with the capable residents or the powers of care, discussing COVID and disease progression, and many of them don't want to go to hospital.
Mm-hmm.
Yeah. Now, what does the hospital say?
Well, apparently, now this is what the CEO is saying, is that the hospital is prepared to take them. But then I look at some of our very advanced end-stage dementia people, and these are generally the families who don't want their loved one going to the hospital.
Yeah.
So I'm really in a dilemma now.
They'll be alone in the hospital because they can't have visitors. I think that, right, the long-term care, at least the staff know them and can support them there. I don't know.
Oh yeah, and
it just breaks my heart to think.
Yeah.
Mm-hmm.
I have to explore it more. She introduced it as part of the most recent directives from the ministry in long-term care.
Heather or Doris, can you comment?
Yeah, it looks like Doris is just have to take a phone call, but we're getting comments from others that from Cheryl, for example, wouldn't the goals of care supersede the CEO's directives? Yeah, it's
Well,
an interesting.
that's my perspective, is to me, if the individual doesn't want transfer, we can't force it on them.
Yeah. And I'm just looking to see, there's a lot of other coming in. Okay, that's good.
Yeah. Okay. Well, let me move on. There's lots of questions here.
And I'm just keeping an eye, Irma Jean, it's like 6:27 right now.
Ooh,
Sorry that I stepped out. As you can see, I stepped out because I needed to see my grandkids that stopped with the car to say hi.
Oh,
that's nice.
Okay. Yeah, it's
And
lovely.
Pura Viva was saying, lower the window, lower the window.
Oh, okay. Doris, we were just noticing the time. I'm just looking, Heather, at the questions here.
There's quite a few that we could maybe bring forward
Go
to
for
Monday.
Go for it.
Go for the questions. Should we carry on for a little
Sure,
bit?
let's do a couple more, because I think some of them have been, there's been responses in the chat, so.
Yeah, there is. And again, Wendy, you're getting lots of kudos. So we're
Now, I want to make sure that no one else gets scared of giving good things because they get homework, because poor Jean, she started to talk about good things. She needed to develop a poster. Now Wendy talks about good things. She needs to do 300 words and an interview. Next one that says good things, who knows what you will get.
Okay, now we're asking a question. When are we going to get direction to swab everyone systematically in long-term care despite description for atypical symptoms?
Not yet, because right now what they want is to ramp up basically swabbing and doing the test. And well, they may include, actually, sorry, that is incorrect. One of the guidelines, if you go to the bottom, speaks about the asymptomatic symptoms.
Yep.
So look for it. It's there. I read it last night. It's there. Well, this morning, whatever time it was. It's there. Have a look, please.
Oh, okay. Now there's, so you're saying, Doris, that swab everyone.
If there is one person that is suspected or confirmed, everybody needs to be swabbed in that home. That is the directive, and also every staff that works in the home. If there is nothing in the other homes, the government is saying nothing. RNO is saying that we should do for surveillance at least some random swabbing of people that either you think are more critical and you are afraid if they get something, or people that have anything that is not the usual, just to get a sense. Surveillance, basically. And the same with staff.
Okay.
And that's what the other places that are doing a good job are doing.
Yeah.
Like this is.
Okay, so that's good and clear.
Yeah, and I think that's covered a couple of things here in the chat. Yeah.
I think we're pretty good here. Ontario self-assessment needs a significant update.
Thank you, Shaila. I saw it and I will make sure. Shaila, send me the link, although I can find it in my reports if I go by topic. But send me the link if you have it handy. And if you actually, Shaila, if you want to write comments on it already, even if it's tomorrow morning, so it doesn't need to be now, do that. You know, with the sticker, you can put them, and then I will submit that. Please do.
Yeah.
Okay, now.
And if there's anything, go ahead. No, go ahead, Irma Jean, please. Sorry.
I was just going to say from Beth Sweeney, and I don't know if you're still on, Beth, if you want to maybe speak about this, about how false positives might arise. Beth, are you there that you can unmute?
Hi there, yes, I am.
Yes.
Yeah, it's been said that most false positives are due to the nasopharyngeal swab not being put far enough back into the nasal passage. And so that's what I was wondering, if that could be the reasoning that I'm just asking, is it in your homes personally that you're getting false positives? because that's what they're saying. It's inserted deep enough, and that's possibly the reason.
For false positives or false
I'm
negatives?
giving it from what I read.
Yeah.
I don't know in which homes or not.
Yes.
So my comment related to reports that have been about that.
Oh, I was saying false negatives. You're saying you heard
I'm
that there's
talking false negatives.
Oh, thank you. Yeah, false negatives.
Yeah. Okay. Well, that's a very good point, Beth. So maybe that's something to consider. Okay, to make sure we're doing it exactly the appropriate way.
Can I just go back? Can I have
Yeah.
one more question? It's Beth again. I just want to make sure that NPs, if they're doing swabs, they're using their own recs. I got a sense in some conversation that some NPs are using recs from the docs, but if we're NPs and we have our own billing number and we're doing a test, we need to use our own recs, and therefore by law, we have to get our results back. It's just no ands, ifs, or buts about it. Is that a discussion point?
Beth, sorry.
I think that I think one of the colleagues that said that she didn't do the test was because she was not there, Beth, that day. That's why the doctor ordered that. Is that the one you're speaking, or I missed something?
No, I don't think so. I think that was it, Beth. And most people have commented that they are doing the tests and they are getting the results.
So is Claudia able to comment?
Yes.
Claudia, do you?
Yes, so all the tests that I do in the home, all the requisitions that I write, they are under all the doctor's names. So even though I use my own number, it comes to the doctor, and there's none that comes with my name. So I am not able to access. It's funny, yeah.
Okay.
But you can contact the Ministry of Health yourself, Claudia, and just get your own recs. That's what we all did and do.
I don't know
Beth, can you facilitate sending the link of how to contact to Heather, and Heather will send to Claudia? Claudia, is this the same Claudia was talking about that she was not there before?
Yes.
Yeah.
Claudia, I mentioned you in the news.
You did?
I did, Claudia. I was yesterday in an interview that was a live interview, and that people were calling with questions for me, etc., etc. And this gentleman showed up that spoke about how fantastic the care in Silverthorne was, and that he just wanted to say to everybody, thank you, thank you, thank you. And I then answered that I was so pleased to hear about that, and that he needed to know that there is a nurse practitioner in that home. Her name is Claudia, and she's fantastic, and it makes a huge difference for residents. Here you go.
Thank you. Thank you so much.
Okay.
Oh, your name was all over the news.
So glad you turned up.
Yeah, Heather, I sent you the link to where I read about the 25 to 30% false negative. You can send Kyle, or you can send to people.
Yeah. Okay. Okay. We're going to just do 2 more questions here. Somebody has said we currently have 2 residents in hospital. With the new regulations of not admission to long-term care apply to these residents?
Likely, yes. But I can ask tomorrow morning and let you know. I will ask tomorrow morning and let you know. In fact, I will email today and I will let Heather know to send. Or who is coordinating? Is Kyle coordinating cancers, or you, Heather?
Yeah, I think Kyle and Heather are, but Kyle will, yes.
Okay.
Good?
Okay, good, good.
There's just one more question here. It's a comment about, could the coordinators, and I'm looking for it again, Heather, I don't know if you've seen this, could the coordinators put together something that reflects the kinds of approaches Wendy has suggested of what are some ways to manage through a COVID outbreak. Any thoughts on that? Now, if Doris puts some, or if Wendy writes that up and Doris puts
it in her update,
maybe that can get the message out there.
Yeah, I think so.
Yeah, okay.
That, and we can also post it then on the resources, Heather, once it's out.
Yeah, so we can pull it together and post it, and yep, that's fine.
Okay, so Wendy's going to do her homework right now.
She's just posted, I'm getting on my homework, she says. So
it's good. I appreciate that. Thank you. It will be very important. And then tomorrow morning, ask your director or whatever title, a leader in your place. And really, when you guys have green light, it will be a phenomenal story.
Yeah.
And I want to go big with that, like national news or something big.
Yeah.
Because
so just
all we hear is bad stories. We need a good one.
Yes.
Yeah. So just to wrap up, just wanted to let everybody know that there are a number of webinars that are still taking place with Public Health Ontario. They're hosting webinars, numerous repeat sessions about outbreak management in long-term care and retirement homes. And so they've got sessions that are happening, right after this meeting, but also tomorrow, Saturday, and Monday. And you can access those through Eventbrite. And we've got the link here, and we'll send that out to you so that you can access those if you're interested in attending.
And we are included on those links, on those emails, right, Heather?
Yeah, and the other thing I just wanted to comment on is that last time we were together, we commented on the palliative care webinars that were happening. And so we were able to get all of the slide decks and the resources that were shared during those sessions that occurred over the holiday weekend. And those Kyle has posted on our NP website, so they're available for you to access as well if you're interested.
And the other thing, Heather, what about the webinars that happen with the coroner? Are those posted somewhere that one can
no, I'm sorry, Doris, I think I misspoke. I think those are the ones that we were able to get the information for. Yeah.
So where can we find them? I want to watch one of them.
Okay, they're on our NP website. We've got a page for our NPs that we're posting all the resources following this meeting, so we can send you the RNAO link to that.
Fantastic.
Kyle, you can help with that.
Can I put that in my report also or no? That link?
I don't know. Kyle's just posted it here. I see. Is this the one?
That's
anyway,
the link. I do think that we had discussed that there was a number of peer shared resources, and so that we initially said that we wouldn't share it more broadly.
Maybe we could find the higher level link for you, Doris, to share in your report. Well, I'll see if we can figure it out.
The other thing, it will be good to make a link between our resources and website to Advantage Ontario. I was looking yesterday, they have also very good resources.
And actually Advantage Ontario has been working with Wound Canada that has made their PSW education sessions available free of charge.
But we should do the same for ours.
Advantage. Yeah.
So Heather, maybe you can talk with Advantage Ontario because our students should get that course too.
Yes.
Okay.
Yes.
Okay. Yeah. No, I think they're cross-pollinating all of those, but I'll make sure. Yeah.
Especially that we have given them also a lot of resources. So
and Doris, and they're absolutely including all of our resources in their daily updates. There's no question about that.
Good.
Okay, let me close the session then. And Doris, as always, inspiration and information. Thank you for joining us, and thank you for everyone around the table, and in particular the wonderful cross-sharing and the real life stories you're sharing with us very openly. It really makes a difference because this information is really only coming from you. As someone mentioned, I think on some TV, announcement. There isn't a book I can open to find the information I need in a lot of these situations. So we're creating it right here. So thank you all very, very much. And
before we go, though, Imagine, should we do the click, click, click?
Oh,
We need for tonight.
Okay, well, we could.
We do. And some people have posted fabulous pictures of the whole group.
Kyle needs to undo
Open us.
Everybody has to open themselves.
Put Wendy on the spot.
All there. So take yourself off. If you can, take yourself off mute. If you can put your camera on, that would be even better. So we see more than your name.
Yes, we want to see faces. And some, you can bring kitchen items, shoes.
Hold on.
Your hair looks fabulous.
Everybody.
I can't unmute my video.
Okay,
If you can't put your
when we need to up
Old
everybody.
nurse practitioners on here.
Okay, bye everyone. See you
Okay.
Wednesday.
Okay, hang on.
I haven't done it. Oh, I thought I'd
Look at them all. They're all grandmas. They all look like grandmas. They're doing this thing where they're standing pat.
Thank you, thank you, thank you.
Thank you, healthcare.
Thank you. Thank you.
President of the RNAO, Doris Christian.
Together we can
RNAO,
do
right?
it for
Thanks.
the health professionals, nurse practitioners,
Oh,
RNs,
wonderful.
RPNs, doctors, and every
Thank you.
worker. Together we can
Do it.
Yes, we can do it.
Thank you.
I missed the first
Thank you,
half.
everyone.
Thanks, everybody.
Kyle said that the